Nicole, Cosmetic Dermatology PA, with your monthly ihelpMoms Beauty and Body Spotlight. This month, in honor of motherhood, I've decided to share something personal with our community that you yourself or other moms that you might know can probably relate to as well. There are a few dermatologic conditions that affect the face and body throughout our transformation into womanhood and beyond. One such common indicator of these hormonal changes is melasma. Many women defeatedly accept that this is a cross that they just have to bear. But should you really be okay with bearing that cross when it's on your face? Let me answer that one for you. No, you don't have to, at least not anymore. Other names for melasma include the mask of pregnancy, cloasma, or the latest one, which my husband has lovingly coined for my own personal presentation, mustachma. I just love his sense of humor. So we make jokes, we cover with makeup, we do what we can to mask the mask and all the frustrations that come with it. So let's start as we always do, by establishing an understanding of what melasma is. This is a hyperpigmentation disorder, which affects characteristic facial areas. I'm going to show you some pictures now, and you can see it presents in all skin types, all ethnicities, and at any time. I myself thought that as I didn't get it after my first pregnancy, I was in the clear. Well, I was wrong. 2 months into baby number 2, and still as I finished weaning baby number 3, I can say I was not an exception. What is sometimes a result of exogenous, which means supplemented from the outside, or endogenous, meaning naturally occurring in the body, hormone imbalances, melasma can occur in and around pregnancy through the use of birth control, in certain endocrinopathies, or even for no reason. If you've ever wondered or read about melasma, then you already know that there are many recommended modalities. Some of the more common ones are chemical peels, IPL, pico laser, and topical concoctions. These are marginal and temporizing at best. Now, the cost of these methods also add up, as do mounting frustrations when all you want to do is be able to roll out of bed and not have to drown your beautiful skin in cover up. So let's cut to the chase. There's so many different options, but what really works? Then and now, I can confidently say the active ingredient in any approach that works is hands down hydroquinone. Now, I'm not talking about your over-the-counter 2% cream. I'm talking about titrated hydroquinone formulated together with additional ingredients and enhancers such as kojic acid, vitamin C, beriberi, arnica, and arbutin. Go big or go home. Unfortunately, melasma is a chronic condition. Much like high blood pressure or diabetes, it always has to be managed. With proper skin priming and simple maintenance routines, we can beat melasma and we can keep it away. Here's an example of one of my patients who is a mom of multiples. We started by priming her skin with microneedling and PRP. We immediately started seeing her pigment break up just after the first microneedling session. She was also instructed to religiously apply a high concentration zinc sunblock, which we formulated for our office to blend in for easy and seamless application beneath makeup. We chose to maintain her natural appearance with glycolic peels of increasing strength and duration in the interim. Finally, we introduced a custom formulated hydroquinone compound that was titrated to the type of melasma of this particular patient. Once the melasma is entirely clear, we devise a maintenance regimen of the glycolic acid creams, retin-A-type products with periodic hydroquinone intervention. Some things to keep in mind: if you're currently pregnant, baby's health is priority over mommy's good looks, and there's not a lot that you should be doing to treat melasma outside of sun protection with block, wide brim hats, and keeping cool, as even the heat alone can cause you to flare. There are certainly some category B prescription medications used for hyperpigmentation that are safe in pregnancy, but again, they are marginally effective and stabilizing at most. Remember, you're only pregnant for 9 months at a time, and this time is so special, and one of the last things you need to be concerned with during this special time is your skin condition. Although it is a very difficult condition to treat in the past, or it was, melasma has become a Rubik's Cube worth solving. On top of the tried and true modalities I mentioned, there are some new and exciting developments on the horizon. We have started to recommend such powerful antioxidants and sun protectors as Heliocare Advanced, Erifotona actinicus, and tranexamic acid. You can DM me for those specifics. When picking your melasma treatment, make sure to consider that any heat-based modalities may worsen melasma no matter who does it. I tried to share a lot of information here today, however, there's so much more that I would love to discuss. If you would like to direct message me at Aesthetic Skin Surgery on Facebook or on Instagram at Aesthetic Skin, that's aesthetics with an X, I'd be happy to answer any questions that you may have about your own personal experience with melasma. In the meantime, here's wishing you a Mother's Day full of joy and love, because there is nothing more beautiful than the magic that we make with our family.